Now, the analytic phase. Now, the analytic phase is the actual phase where the actual test is being done in the laboratory by the laboratory scientist. And the post-analytic phase is after the analysis, the reporting of the analysis done with the data acquired and the interpretation of that report. These are the three phases: the pre-analytic phase, analytic phase, and the post-analytic phase. Now, in hematological tests, basically it is the test done on the blood and its components. So, the composition of blood. What are the components of blood? Two main components, that is a formed element and the plasma element. Formed element is of 45% and plasma is of 55%. The formed elements are composed of three types of cells, that is the WBC, the RBC and the platelets. WBC also called as the leukocytes, RBC is called as the erythrocytes, and the platelets that are also called as the thrombocytes. The WBCs are composed of 5 cells: the neutrophils, basophils, eosinophils, lymphocytes and monocytes according to the granules and which are present and absent in the WBC cells. And the RBCs and platelets, these are all forming the formed cells which is made in the bone marrow of the stem cells. Now, the second component of the blood is the plasma, which consists of water and soluble substances including electrolytes, clotting factors, immunoglobulin factors, protein, lipids and hormones. Every substance the cell uses is transported by the plasma within the blood. So, these are the components that are sent within the plasma, and everything, ഓരോ സെല്ലും അതിൻ്റെ അകത്തിരിക്കുന്ന കമ്പോണൻസിന് എന്തെങ്കിലും ഒരു സബ്സ്റ്റൻസ് ഒരു സെല്ലിൽ നിന്ന് വേറൊരു സെല്ലിലോട്ട് പോകണമെന്നുണ്ടെങ്കിൽ ഈ പ്ലാസ്മ വഴിയാണ് ഈ സെൽസ് അവരുടെ സബ്സ്റ്റൻസിനെ അങ്ങോട്ടും ഇങ്ങോട്ടും ട്രാൻസ്പോർട്ട് ചെയ്യുന്നത്. Now, these are the two components of the blood. Now, there is something called as serum. What do you mean by serum? It is the fluid remaining when the blood is allowed to clot. It closely resembles the plasma with lack of a few coagulating factors.